work so much, trying to improve a standardized curriculum for ophthalmology internationally, and you've done this teach the teachers thing for so long now. But you can have the best curriculum in place, you can have all the resources in the world,
Mhm.
but it's really incumbent upon, or it's really up to the resident to figure out how to utilize that and how to succeed with that. What do you think are some good
Yeah.
qualities that make up a good resident?
Yeah, I mean,
Top
I
qualities.
think that's true. Obviously, the resident's got to be motivated, but I mean, there's certainly. I don't think it's all on the resident either. I mean, I think you got to have a good system. You hopefully have good teachers. You have faculty that are really interested in teaching, want the residents to succeed. You have the hopefully the resources that you need for that. I was just informed that our IC is like at its life expectancy or something, and that we have to get a new one. Which I'm not sure how we would do that, but anyway, you want to have the right resources. But I think, when we want, I mean, we think of the residents as junior colleagues. I want to walk into that room with a patient who the resident just saw, and that patient say, wow, that was a great young doctor. And that happens all the time. I want them to be able to communicate well. I want them to be professional and ethical. I want them to really have that, thirst and hunger for knowledge, that they want to know what I know about neuro-ophthalmology, or when they're doing cornea, and I think that's what all the faculty want. I mean, with one of the things that we get a lot of complaints of from, I won't say which faculty, are that, well, they don't really like this part of ophthalmology. They're not interested, and I tell the resident, I don't care if you're interested. I don't care if you're interested or not. Pretend you're interested. You're going to get a better evaluation. Just pretend you're interested, and maybe you'll learn more. So I think that's what the doctors, the teachers want. The teachers want their residents to succeed. I hope the teachers want their residents to be better than we were, or we are, in the future. And that's, I think, where the real pride in teaching residents is seeing them go out and succeed and do well and be productive and so on. So I think it's the motivation. And, I think it's most residents, at least, that I've had experience with in our program, they're generally usually pretty motivated, I think. So I think that's what I would say. I don't know that there's any. I mean, you got to be smart, obviously, but everything we look at on the applications are about how smart you are. So if we can't pick you by that criteria, then we're in trouble.